Hello guys, welcome back to my channel Connect Radiology. So today's topic of discussion is osteonecrosis of femoral head, previously known as the popular avian avascular necrosis of hip, the most common site for osteonecrosis. So we are going to discuss the MR imaging of osteonecrosis of femoral head, and in that too particularly about the popular Fichet classification. Okay, so it was given basically for X-ray findings of avian, but now extrapolated for MRI as well. So we are going to discuss about the MR findings of avian of femoral head based on Fichet and Arlet classification. So in stage 0, the MRI is normal. The stage 1 is just bone marrow edema. Just bone marrow edema is not pathognomic for avian. There can be multiple causes like transient hip edema or the osteomyelitis or any stress fracture. So these are not pathognomic. The stage 2, in stage 2, what we can find is the geographical signal change. We'll discuss that. In stage 3, what is characteristic is this crescent sign or the subchondral fracture. This is characteristic of stage 3. And in last stage 4, there are symptoms of osteoarthritis. The femoral head collapses and findings of osteoarthritis appears. So these are the 4 stages: the bone marrow edema, then the geographical signal change, the crescent sign, and finally osteoarthritis. So among these 4 stages, the main role of radiologist lies in this borderline. We have to differentiate 2 and below and 3 and above, because it's the line where the management changes. Up to stage 2, conservative management is done, and after stage 2, the main treatment is surgical. That can be total hip replacement. Okay, so the main role of radiologist is to differentiate 2 versus 3. Now let's discuss the findings of avian on MRI. So this is the sagittal T1 image. That's the best sequence for screening to rule out avian. Here what we can see, this geographical area or the crescentric subchondral area of avian at the anterosuperior femoral head. So this is the characteristic geographical or the serpentine or the crescentric area on T1. Okay, next thing is T2. T2 is very characteristic because it shows the double line sign. What do you mean by this double line sign? What we can see, there is very small focus of avascular necrosis with double line sign. This inner line is hyper intense on T2 and the peripheral line is hypo intense on T2. The inner T2 hyper intense line is actually the granulation tissue zone, while this hypo intense line is the sclerosis, that through which the body is trying to limit this avascular zone. Okay, so the inner line is hyper intense corresponding to the granulation tissue, and the outer line is hypo intense corresponding to the sclerotic rim of this avian. Okay, so this double line sign is pathognomic MRI finding seen at the periphery of osteonecrosis. That is actually representing the border between the viable and the non-viable tissue. Okay, so this is double line sign. This is the crescentric or geographical or the serpiginous subchondral area of avian. This is double line sign. So this is like finding of avian. Now as I said, we have to differentiate between 2 and 3. So in 3, what we can see is this crescent. Can you appreciate? There is a very thin linear lucent subchondral fracture. This is actually the crescent sign, and once this subchondral fracture appears, it means it will eventually collapse. So this crescent sign lies in the stage 3 of avian. Okay, so this we have to like look carefully for this crescent or the subchondral fracture. Okay, another thing is this rim sign. Okay, we have to look for this rim sign. What is rim sign? Rim sign is a hyper intense line that has hypo intense line on both its sides. This is rim sign. A rim sign is actually representing fluid between the sclerotic borders of osteochondral fragment. If this rim sign is present, it denotes the stage 3 or indirectly the crescent or the subchondral fracture. So this is the rim sign. So we have described the 2 important signs: the double line sign, that is pathognomic for avian, then this rim sign which comes in stage 3 of avian corresponding to the crescentric, the subchondral fracture. Okay, now let's know about the weight bearing area of avian. Subsequently, we will discuss why we are discussing this. So let's know about the weight bearing area of femoral head, and that is predominantly the antero-superior part. For that, let's know about the teardrop. So this teardrop is actually located inferomedial in the acetabulum, just superior to the obturator foramen. So this is the teardrop. Okay. So what we have to do is, like, we have to draw a line. We have to draw a line that is along the teardrop and through the acetabular edge. Okay, so this is the acetabular edge and this is the bottom of the teardrop. When we join these two lines, then a vertical line, a perpendicular line through the mid part of this line, and what lies actually here is the weight bearing part, of the femoral head. Okay, the line joining the acetabular edge and the bottom of the teardrop, through this line, a mid vertical line, and what lies lateral to it is actually the weight bearing portion of the femoral head. Okay, so why we are discussing about this weight bearing part is because the percentage of this weight bearing part involved determines the prognosis of avian. Because if more than 2/3 of this weight bearing part of femoral head is involved, there are 74% chance that this avian will subsequently go into collapse phase. Okay, and another important thing is the necrotic size. What's the size of this avian, the necrotic area component? If we consider the femur as a circle and divide it into 4 parts, like if less than 25% of the diameter of this circle is involved, then there are less chances that this avian will eventually go into collapse phase. So what we saw that the two important things are the percentage of the weight bearing area and the percentage of the femoral head and the size of the necrotic fragments are important determinants of the prognosis of how it will go into future. Okay, so now we will discuss 3 important things that are very important in, like, determining the prognosis of avian. Okay, so one thing is the articular surface or the percentage of head involvement. Okay, so this is actually the percentage of articular surface or head affected, like mild, moderate and severe. Mild is less than 15% of the articular surface or head affected, moderate is 15 to 30% of the articular surface involvement, and severe is more than 13% involvement. So like in this image, what we can see is, like this case, there is less than 15% involvement of the articular surface. So this category is like mild, severe is more than 30%, and in between is the moderate. Okay, so this is the percentage of the articular surface or head affected. Next is the how much percentage of the weight bearing portion is involved. Okay, weight bearing portion involved, and this is given by the JIC classification. So here what we have done is we have divided the femoral head into thirds. Okay, by the same, this is the line, the acetabular edge and the teardrop, and then we have divided into thirds. Like if the lesion is seen involving just less than medial 1/3 of the weight bearing portion. Okay, so this is actually the weight bearing portion. Okay, this is the weight bearing portion. If only less than 1/3, okay, less than 1/3 is involved, then this is type A. Then type B is less than medial 2/3. Okay, so this is actually the weight bearing part. Okay, if 1/3 and 2/3. Okay, if more than 1/3 but less than 2/3 is involved, this is type B. In type C, what happens? More than medial 2/3. Okay, 1/3, 2/3, and see, this involvement is more than 2/3. So this is more than 2/3 of the weight bearing portion involvement, but it is not extending laterally to the acetabular edge. Okay, this is type C1. And in type C2, what we can see is this is extending laterally up to the acetabular edge. This is getting involved. Okay, and as it progresses, as the size of involvement of the weight bearing part rises, the chances of collapse rises. Like in type A, it is less than 10% chance of collapse. In type B, it is 40%. In type C1, it is 80%, and in type C2, it is like more than 90% chance that it will collapse. So amongst the prognostic factors, I have discussed the percentage of the articular surface or the head affected. Then I have discussed the portion of the weight bearing surface involved. Another important is the size of the necrotic fragment, and that is given by the modified Kerbal angle. Okay, the arc of the necrotic portion.